Time now is 6:44. When your child can't find the words, maybe help them find the lyrics. Sound It Out is a new national campaign. It launches today, and it uses the power of music to help parents and caregivers have conversations about emotional well-being with their middle schoolers. Joining me now live from Arlington, Virginia is a mental health expert, Dr. Alfie Breland Noble. Thank you so much. What a great effort here. Thanks for joining us.
My pleasure.
Well, tell us more about the National Sound It Out campaign. What is it?
Sure. So the website for the campaign is sounditouttogether.org. This was put together by the Ad Council and Pivotal Ventures. Everyone knows both of these organizations well. And our focus is to really help parents find the language to speak about emotional well-being and mental health with their young people ages 10 to 14.
Why is this so important for parents to make that effort to talk to their middle school age kids about emotional well-being?
Well, it's for many communities, particularly the communities of focus for this initial rollout of the campaign, African American and Latinx specifically. Emotional well-being and mental illness and mental health are highly stigmatized. And so what we want to do is to begin modeling early. I'm also a parent of young people, and we want to model for them early what it means to talk about your mental health openly, to talk about your emotional well-being openly, and we want to give them a vocabulary for this.
What about parents or caregivers who say, I want to be more proactive about my child's emotional well-being, but I don't know how to start? What's the best thing they can do to just start this process?
Sure. So that's the beauty, part of one of the many beauties of the campaign is they can go to the website, sounditouttogether.org. They can listen to the music. It's really rooted in music, which is a universal language for so many of us. It gives parents an opportunity to read through some of the tips and strategies that are included on the website. And it gives them a place where they can start the conversation by listening to the music and reading the lyrics with their young people. So it gives them a way to focus on something together rather than having to focus on each other, specifically because in that age group, sometimes it's really hard for parents to connect with kids if they're both sort of staring at each other. So you can direct your attention to the website, the music, the lyrics, and it gives you a place to start.
Music really does do a great job of bringing people together, maybe bridging that age gap between parents and their kids. Let's talk about the pandemic now. We've seen this impact kids so much. How are you seeing it impact the mental health of these middle schoolers?
Sure. So a couple different things. We know that there are greatly rising rates of reports of anxiety and depression among our young people, in part driven by the isolation and lack of socialization that they're able to experience because so many of our young people are under quarantine and have to be at home. There's also this issue for our young people who come from additionally marginalized populations where they're not able to express themselves. Say, for example, if they're queer, they're not able to express themselves as freely because they don't have their peer groups to really help them engage. And then finally, for a lot of our young people, they're having to deal with the stressors that they're watching in their parents and the people around them and really don't have an outlet to express that. So we've seen things like increasing expressions of suicidality. We've seen, as I said earlier, reports of young people reporting much more anxiety and depression, in large part due to some of these challenges we're experiencing through the pandemic.
Yeah, a lot more isolation. Well, the website is sounditouttogether.org. Dr. Alfie Breland Noble, thank you so much. Such an important topic and cause, and great to see the efforts you're working with to bring these parents closer to their kids. Thank you.
Thank you. My pleasure.
All right, Scott, we'll send it over to you.